Hi, my name is Grace Herendeen, and my topic is meditation for stress reduction in nurses. As we all may know, nursing is a super versatile workplace, and there's a large scope of practice. And there's a lot of factors that can leave nurses feeling overworked and stressed and emotionally exhausted. Nurses have to work around time limitations, emotional trauma, and long work hours. And so it's really important for nurses to practice self care. And since we're all going to be practicing nurses at one point, I think it's a super vital topic to investigate. So, what we're really going to be looking into is, does meditation have a positive influence on practicing nurses? And when I say positive influence, I mean, does it decrease stress? Does it improve mental health? Can it lead to a higher quality of care? And can it prevent burnout? We all may be familiar with the term meditation, but I just wanted to give a quick definition. This is by Leto et al., and they characterize meditation as the practice of using contemplation, reflection, and centering with oneself to achieve relaxation, calmness, and clarity. The first research we're going to be talking about was done in 2020 by Lambert et al., and they utilized a phone-based meditation application. They got their sample from convenience sampling. They acquired a group of 39 people, but due to attrition, only 25 of these participants actually finished the study completely. The 25 participants were split into a control group and an intervention group. The intervention group utilized the meditation application, and they were instructed to use it about once a week, while the control group didn't utilize any form of meditation at all. They evaluated the data with use of questionnaires before and after. The data afterwards did show a decrease in stress, anxiety, and depression. While this was a randomized control trial, which is a super high level of research, there were still some limitations to this research, such as there being only one phone-based meditation application, so there wasn't much variety, and that it was only done at one institution, and mostly that the sample size was so small due to attrition. The next research is done by Leto et al. That also utilized a phone-based meditation application, but they approached it really differently. They did a phenomenological approach, and this qualitative approach really let them investigate the experience that these participants had. By documenting their verbatim responses to interview questions, they really provided a glimpse into what these participants experienced. Everybody in this study really had a positive experience with the phone-based meditation application. There were still limitations, and the limitations identified were that some of the people didn't understand how to use this application due to it being technology. And so a recommendation that they proposed for that would be to provide education on how to use it beforehand. And another limitation was that it was only one phone-based meditation, and that application didn't have a lot of variety within the app itself. But they still found that the participants liked that it was an app, and so it was really sculptable to their busy lifestyle, which is something that nurses really need. This research done by Steinberg et al. In 2017 was a longitudinal experimental study. They implemented the use of meditation and mild yoga and music. They evaluated their data before and after the intervention was done with questionnaires, specifically the Maslow Burnout Inventory Questionnaire and the Professional Quality of Life Scale. And they did conclude that there was a reduced sign of burnout, reduced poor mental health, and reduced physical illness. One thing that I thought was really interesting about this study was that the researchers concluded that the most beneficial part of this entire thing was noticing that we can't change the stressors. The stressors are never going to go away, but equipping people with effective stress reduction techniques, such as the meditation, yoga, and music, can lead to better responses to the stress of burnout, poor mental health, and physical illness. Westphal et al. Did a non-experimental research design, so there wasn't any intervention, but these researchers provided them with questionnaires and scales to rate their depression, anxiety, stress, and their use of mindfulness, 4 different scales. And they found that there was a correlation that people that had higher levels of mindfulness meditation use had decreased reported stress, depression, and anxiety. So this literature review had a lot of different levels of research. But the next step would be to do a multi-site randomized control trial, because we really need to see a bigger sample size, bigger demographic, different geographical factors, and over a longer period of time. To implement this, we really need the foundation to be laid by nurse educators. If they teach stress reduction techniques in their curriculum and the importance of stress reduction, then nursing students will be better equipped to go out into the workforce. The next group that really needs to be involved is hospital administration. They really need to support this, because a big thing that holds meditation back is peer scrutinization. And so if it's an administration level thing, that peer scrutinization will not be as present. And their support will also provide adequate time for nurses to really implement this. And they can even provide a mode of meditation, such as those phone-based meditation applications, or even a meditation room on site at these hospitals. And hospital administration should really support this use of meditation, because meditation can protect psychological health, improve quality of care, and decrease turnover related to stress and burnout. And that decreased turnover is economically beneficial for each institution. So that's why they should really care about the implementation of meditation. And we can evaluate the effectiveness of these meditation techniques by seeing if there's a reduced rate of turnover related to burnout and an increased rate of workplace satisfaction. With larger scale studies over longer periods of time, with collaboration between nurses, hospital administration, and nurse educators, we can really begin to understand and utilize the positive benefits of meditation. Thank you. And these are my sources.